Hello, my name is Kayla, and I will be doing a presentation on 2020 Hospital National Patient Safety Goals. I'm going to talk about the professional nurse and patient safety. There are two significant nursing functions that closely influence patient safety and quality of care. They are the nurse should be closely monitoring for early recognition of adverse effects, complications, and errors. Also initiating deployment of appropriate care providers for timely interventions and response/rescue of patients in these situations. You will need an adequate nursing staff to carry out these safety outcomes successfully, and you also need to make sure that all care providers pull together to improve this safety. BS and essentials that I chose was Domain 5, Quality and Safety, and Domain 7, System-Based Practices. For Domain 5, Quality and Safety, the employment of established and emerging principles of safety and improvement. You should also use Quality of Safety values nursing practices, enhances quality, and slows the risk of harm to patients and providers through both system effectiveness and individual performance. In an environment fostering quality and safety, caregivers are empowered and encouraged to promote safety and take appropriate action to prevent and report adverse effects and near misses. With system-based practices, nurses effectively and proactively coordinate resources to provide safe, quality, and equitable care to adverse populations. The system-based practice is predicted on an ethical practice environment where professional and organizational values are aligned and structures and processes enable ethical practice by all members of the institution. The important quality and safety education for nursing used is quality improvement, which uses data to monitor the outcomes of care processed and use improvement methods to design and test changes to continually improve the quality and safety of healthcare. One of the skills that should be used is to seek information about outcomes of care for populations served in care settings. I also use safety, which minimizes risk of harm to patients and providers through system effectiveness and individual patients. Through this skill, you should demonstrate effectiveness, use of technology, and standardized practices that support safety and quality. I will talk about some evidence-based practice article that I found. The current ratio related to falls are 3.63 falls per 1,000 occupied patient days on an average equates to more than 1,700 falls every year in an 800-bedded hospital. Also, a hospital with 800 beds will have approximately 1,500 falls at the cost of $3.9 million. So you know that falls are probably not covered by insurance, and whenever something happens to the patient, like if the patient falls and breaks a bone, we have to cover that cost because it's our fault, the hospital. Also, some ways to prevent fall is to set a bed alarm, have call bells, have the bed in the lowest position with some side rails up, not all four because that will mean restraints, and also get help as a nurse to lift and transfer a patient. Patients are varying in sizes, so you want to protect your back and protect from you hurting the patient, so you should always get help. And you should always use the fall risk assessment score in a patient on a mission. Also, I have this picture right here. It says, please call, don't fall. Your safety is important to use. Your safety is important to us. If you need to get up, use the call button for assistance. So I would make sure as a nurse that every time I leave a patient's room, I make sure the call bell is in reach and let them know that if they need to get up or if they need something to call, because I don't want the fall to be responsible for me because I wasn't safe. My reference page.